I didn't know I was carrying that much around, but I'm thrilled with the results. I can't believe it. That part of my body was bothering me for so long. It's just like a whole new body.
Fantastic.
Yeah, I'm thrilled. I am absolutely thrilled with the results.
Are you having much discomfort now?
No, I'm just fine. I'm back at the gym, you know, doing all my normal stuff. I was back in about 3 weeks doing everything. Yeah.
Great.
Yeah.
Well, you look fantastic.
Thank you so much. This has been awesome.
More than welcome. Now, you know you'll have your final result in about 3 to 6 months, okay?
Right.
So if you're wanting to buy a new wardrobe, you need to wait a little bit longer because you'll lose another inch or two, okay?
Awesome. I'm
Great.
looking forward to it.
All right.
Thank you so much.
You're more than welcome.
All right.
I'll see you in about 6 weeks,
That
okay?
sounds good.
All right, Angela.
All
Bye
right.
now.
Since my surgery, I mean, my confidence has really been boosted. I mean, I didn't realize how much having this problem area was bothering me. And, you know, I'd worked so hard and, you know, with the gym and exercise, and it was just kind of frustrating, you know, every morning getting dressed, you know, when I'd go out around people, I didn't realize how much that was bothering me until he fixed it. And I'm still exercising, I'm still eating right, you know, I don't expect, you know, I know that I've got to follow through with my part on it. And, but I can't tell you the relief and how much I'm just enjoying looking in my closet and pulling out something and being able to put it on without thinking about how am I going to camouflage something. It's changed me. It's changed a part inside me. It's just made me feel so much better about myself. And I did this for me, and I feel better about me.
Nose surgery, or rhinoplasty, is performed to change the size and/or shape of the nose by carefully removing or rearranging underlying tissues. Most nasal surgeries are performed because the patient desires an improved appearance. However, the surgery is frequently requested to repair injuries or to correct breathing problems.
My name is Molly, and I just had rhinoplasty. My whole life I've been self-conscious about my profile. I've always tried to find ways to hide it, concealers, lighting, some kind of way just to not make the bump on my nose appear so large. So when given the chance to finally remove it, I just jumped on it. When I finally made a decision to go ahead and get the rhinoplasty done, I started doing the research. I started looking in magazines and talking to people around Little Rock and Arkansas who is the best of the best. And I started looking at the before and afters, and Dr. English has a lot of work out there and a lot of ads, and I just kept hearing his name over and over again. Dr. English, he's the best. Dr. English, he's the best. And after meeting him, I immediately trusted him and knew that I had picked the right surgeon. The first thing I remember about meeting Dr. English was when he came into the office and he started speaking, how calm I felt. He just automatically initially got my trust. He started talking about the procedure, and I just knew from the moment I had picked the right person. He has a very calm sense about him. One of the things that I loved about his office and the way he did the procedure is he took pictures of me, he had the technology, he was able to show me exactly what it was going to look like afterwards. He assured me it wasn't going to be overboard. It was a nice procedure, it was a very simple procedure, and I got to experience the whole thing knowing exactly what I was getting into, exactly what it was going to look like before it was done, and that just gave me confidence that he knew what he was doing and it was going to be what I wanted. To be honest, the day of surgery, I wasn't nervous at all. I had met with his staff, I had met with Dr. English before, and I just had the utmost confidence in him. We sat down before the procedure. I once again met the surgery staff, and we went over it, met with the anesthesiologist, and the last thing I said to Dr. English before I went under is do a good job, and I just knew it was going to be exactly what I wanted, and it was.
Good morning, Molly. How are you doing?
Good morning, Dr. English. I'm doing great. Nice to see you again.
Pleasure. Now, how long has it been since we did your nose?
It's been 3 weeks now.
You look phenomenal in 3 weeks.
Thank you. I think so too. I love it.
Did you bruise much?
No, I had a little bit of bruising right here, but the swelling was very minimal. Almost nobody could tell I had any swelling. It was very easy.
Much pain or discomfort?
No, sir. No, sir, not at all.
Fantastic. All right. Let's see here. You've got a really nice shape to your nose. Now, your nose will get a little smaller over time. 80% of the swelling's already gone, and 90% will be gone in 2 months, all right? And then 1% each month for the rest of the year.
Okay.
But you'll have a very nice, natural-looking nose, and I think that will just absolutely look gorgeous. How's your breathing?
My breathing's good. After the initial surgery, it was a little congestion, but now everything works